great day. If you suffer from chronic nerve pain associated with neuropathy, there's a good chance you've been told that your only chance for relief is through prescription drugs or maybe even surgery. But there is a treatment that can address the pain and even reverse the damage to the nerve. And here with more is Dr. Brian Anderson from Blueprint to Neuropathy of Houston. All right, welcome back. Let's start with what neuropathy is. It is a word that we've been hearing more and more about over the last several years, but I think a lot of us still don't understand exactly what it is.
Sure. Well, it's a big word. You know, people have some confusion.
Friends of mine that grew up in areas that did not have fluoride, their teeth were just
don't know that how they got their neuropathy, called idiopathic unknown.
Okay, so, and there are all kinds of reasons that can happen. I mean, we hear it with diabetes all the time, but there can be other reasons why neuropathy happens.
Yeah, there's over 100 causes. Lifestyle, medications, even chemotherapy, injuries, all sorts of things can happen. But basically, if you looked under a microscope, the process is virtually the same. There's a nerve that's not getting enough blood supply. Yeah. And over time, all tissues in the body require that blood supply and nutrients and oxygen to live. And it starts to die on a microscopic level, little by little over time.
Yeah, you have a great example of that whole rubber band theory, or that rubber band example for us.
Yeah, you know, that's how it was first explained to me. That's how I kind of always have remembered it. If you just put a real tight rubber band around the tip of your finger, in the beginning, it would just go a little numb and tingling. It's not a big deal. And that's what people deal with neuropathy. They think it's not a big deal in the beginning. It's just a little tingling, a little numb, and over time, that turns into like prickling and pins and needles. Over time, that turns into burning. My own uncle had toes amputated over time from neuropathy. So over time, when it stays there, it can get out of control and be just severely debilitating.
Yeah, in fact, I talked to a man the other day and he goes, I don't know what to do. He goes, you know, I take the medication, I've been doing that, it's not working, because a lot of times it's not getting to the root cause. And so I told him about you, and he's watching this morning. Good morning, Mr. Fox, how are you? Okay, you know, because you're not getting to the root cause. And so the old way of treating it was either the prescription drugs, things that only mask the pain and doesn't get to the why it's happening. So that's what Blueprint to Neuropathy does. And it's not a one-size-fits-all treatment.
Exactly. So what we do is we actually get to know the human being. We work with all facets of their lifestyle. There's a whole metabolic and lifestyle nutritional component that we take people through. But there also has to be something done to address the blood supply and to re-educate the nerve itself. So medications and surgeries and shots are good to help take the edge off when we're in a lot of pain, but they're not addressing the tissue itself. So what we have put together is a comprehensive approach that delivers creates a process called angiogenesis, which over time you can actually create new arterial growth back to that nerve again and supply it, almost like taking that rubber band off my finger. You start to perfuse nutrients and oxygen into those tissues.
The body wakes up.
Exactly. And then there's also some technology that can help the nerve stimulate and reawaken and learn how to fire again as well over time.
Yeah. So there's another thing that you all do I think is so important. You don't just say, come in, let us do this and go away. You want people to be a partner in their health. You work with them. And that's another reason why it's not a one-size-fits-all.
Exactly, because you have to really want to get better. You know, this is not a passive thing where a doctor fixes the patient. It's not complicated. We are step by step there as a team with you, partnering with you, but ultimately you have to be willing to learn how to improve your life, how to follow the steps over time, because it's not an overnight fix, it's a gradual change over time. And we really value teaching people how to be well for a lifetime afterwards.
Yeah, we've gotten also in a society where we say, does insurance cover it? It's like you could say, look, this will save your life. Does insurance cover it? Oh, if not, I'm going to die, right? But you know, it doesn't. And some, you know, it takes time for insurance to kind of catch up on some things.
Sure.
But when this is effective and it takes care of the problem versus taking care of you managing a problem.
Yeah,
the difference.
Absolutely. You know, this right now, unfortunately, this is not a program that any insurance will cover. So it is 100% cash. It's not insurance based, but we have payment options that make it work for 80% of the population, could be able to work it out and afford it. But think about, like you said, what's your health worth? What's being able to walk with your wife or your grandkids at Disneyland when you're 60, 70, 80 and not be stuck in a walker or wheelchair? Or sometimes people, they can't even drive themselves anymore because they can't even feel the pedals of their car. What's your independence like and worth for you as you age? You know, that's what it's all about.
Who is this program for?
Well, it's for anybody who has a peripheral neuropathy that truly wants to get better and is tired of just using just the prescription pain management, and they want to go through a gradual lifestyle process. And we always start with the seminar because we want to educate people first. So the first thing that we're going to do with you is there's so many things that people don't understand about neuropathy, how the treatments work, or what their options are. So the first thing we do with you is we have a seminar where we actually teach you for about 30 minutes everything that you would ever need to know about how did you get your condition, what needs to be done to correct the tissue, and really how to be well long term, because it really is a long game, not a short game.
Yeah, and that seminar is free. Now, your treatment's not free, right?
Yeah.
or your appointment's not free, but the seminar is free, just so people have an idea of where they stand and what they might want to do.
Yeah, what we're doing right now is we have seminars scheduled over the next 2 weeks. There's some different times, and we're making that available for free to anybody who's really serious about what their options are to get better. So the seminar, basically you come in, we educate you about the process, and then we see if you're a good fit for the program, then you apply to the program, and then you'll meet one-on-one with the doctor after that point.
Yeah, and you give us a chance to ask questions too.
Exactly, yeah.
All right, for the first 25 callers, reserve your spot for the next free neuropathy workshop and meet the doctor to see how Blueprint to Neuropathy can help you. Call this number is 855-240-3177, 855-240-3177, and mention Great Day Houston. And for more information, you can go to houston.yourneuropathyblueprint.com. Thanks again. Coming up, treatment options that will unclog the blockage in your heart and get your blood flowing properly. Next.